So we can detect disorders of next mental functions, such as attention, memory, psychomotor activity, emotions, orientation, personality characteristics. And if you know, I hope you know, disorders of mental function can cause, for example, or Alzheimer's disease or chronic brain ischemia or vascular dementia. Second, next type of functional disorder is disorder of speech and language functions. Maybe oral dysfunction, dysarthria, aphasia, writing dysfunction, dysgraphia, dyslexia, verbal and non-verbal speech problems, and violation of words. We can see here 4 types of aphasia: difficulty to speaking, difficulty to understanding, to reading, and to writing, due to stroke usually. Disorders of sensory function, separate kind of functional disorders, can be causes of persistent disability. There are vision, hearing, smell, touch, tactile, pain, temperature, vibration, and other kinds of sensitivity problems. Vestibular function, also sensory function, savor, and pain. Neuromuscular disorders include skeletal and static dynamic functions, possibility to move the head, body, and extremities, including bones, joints, muscles, and statics coordination. Other types of persistent functional disorders includes also disorders of cardiovascular, respiratory, digestive, endocrine systems, and metabolism, and blood and immune system disorders, for example, HIV, functions of urinary, dermatological, and related system. Very big group of causes, which combines, for example, MI, with MI, with tuberculosis, with peptic ulcer, diabetes mellitus, blood disease, and some other diseases. Separate group of disorders caused by an external physical deformity, the deformation of the face, head, trunk, extremities, which can lead to external deformity of these extremities, abnormal openings of the digestive, urinary, respiratory tracts, or violation of size. We can detect 4 degrees of persistent abnormalities of human body functions. First degree means persistent minor abnormalities in the human body caused by disease, trauma, or defects in the range of 10 to 30%. Loss of functional reserve or functional deficit. Second degree or functional disorder means moderate persistent abnormalities in the range of 40 to 60% of deficit, functional deficit. Third degree, persistent expressed abnormalities in the range 70 to 80%. Fourth degree, persistent expressed abnormalities ranging from 90 to 100%. It's, for example, for immobile patient which can't move independently without any help, any support. The second criteria of disability, it's limitations of any vital activity or activities. For better understanding of this criteria, I will remind for you main categories of vital activity. There are 7 categories. The first is the ability to self-service. Second, the ability of independent movement. Third, the ability to orientation in space and time. D, the ability to communication with relatives, family members, with doctor, medical personnel. Fifth, ability to control the behavior, especially it's maybe problematic for patients with psychiatric disorder. Ability to learn for child with retardation of psycho-emotional, psychological development. And last kind of category of ability to work. Ability to work, and most important, ability. Most important ability for maintenance of patient social activity. Different causes can lead to limitations of vital activity. So this limitation of vital activity, deviation from the normal level of human activity as a result of disease, limited ability to self-service, independent movement, orientation, communication, control the behavior, training and employment. Training and employment. In practice, we can detect 3 main grades of the vital activity limitations. There are, for each category of vital activity limitation, I will demonstrate it separately. For example, the ability to self-service. It is ability to independently meet the basic physiological needs, to perform basic physiological needs, to carry out activities of daily living and personal hygiene. For patients with first degree of this limitation, the ability to self-service possible for longer time of its implementation, reducing the volume if necessary, and possible using assistive technology, such as special spoon, for example. Second degree, then we can consider the ability to self-sufficiency by means of aids and by other persons' participation, relatives or social workers. And third degree, most expressed disability of inability to self-service, then patient needs in constant persistent assistance and care and complete dependence on others. Second type of disability, vital activity limitation, ability of independent movement disorder. This ability, its ability to independently move in space, to maintain balance while moving the body, then the household and occupational activity. First degree of this limitation, it means the ability of independent movement to travel for longer time, fractional performance, and with reducing the distance. If necessary, you can use assistive technology such as sticks before walking. Second degree, it means the ability of independent travel with the regular partial help others, supporters, if necessary, using also assistive technologies. And third degree, then the inability of independent travel and needs in the constant help of others. As for the ability to orientation, this ability to a description of the individual and environment, assessment of the situation by a certain time and location. First degree, these limitations means the ability for orientation possible only in familiar situations on their own and with the help of assistive technology. Work, for example, with any documents. Second degree of limitation means the ability to orientation possible with regular partial help of other people if necessary by using assistive technology. And third degree, it means inability to orientation or disorientation and needs in the constant help and care and or the supervision of others. Supervision of others. It's especially necessary for patients with Alzheimer's disease, for their safety, maintenance of their life. The ability to work, its ability to carry out occupational activity in accordance with the requirements for the content, quality, and conditions of concrete job. First degree of limitation, disability is the ability to work at lower qualification or decrease the volume of work, or inability to continue to work on the main profession while maintaining the ability to work lower qualification. For example, bus driver or train or pilot after serious disease, he can, after trauma, he cannot perform his previous work, but he can work as for example, taxi driver. Why not? If his reactions and orientation are not so bad. Second degree of limitation for these people, then ability to work possible under in special conditions and with using assistive technologies. Special spectacles, special supporters, and other assistive technologies. Third degree is inability to perform work in connection with severe impairment of body functions. So it's full ability to work. Other type and what type of ability? Independent ability is ability to control behavior, own behavior. First degree limitation means partial decrease in this ability to control own behavior. Second degree ability to partially or fully control behavior only by unauthorized persons. These disorders are typical for patients with neurological, severe organic neurological and psychiatric disorders. And third degree, then the inability is full inability to control own health, own behavior, excuse me, own behavior. The ability to communicate. This ability is important to establish contact with other people by sensing, processing, and communication of information. First degree of this disorder, this limitation, then the ability to communication characterized by decrease in the rate, decline in assimilation and receive and impart information. Second degree, we have to confirm them the ability to communicate with the use of aids and or by other persons. And third, the ability to communication with others. And third degree, inability to communicate any other means. So let's summarize the criteria for disability. Main criterion for disability estimation is determination of persistent dysfunctions caused by diseases or consequences of traumas, resulting in the limitation of the vital activity or combinations thereof, determining the need of for its social protection. Limitations of vital activity, the ability to self-service, independent movement, orientation, and communication, control own behavior, to learn and to work. Special organization which performs examination of stable persistent disability in different countries may be different, but in Russia it's Medical and Social Expertise Bureau. This bureau or special organization provides medical and social examination on the basis of disability assessment caused by persistent disorder of body functions, confirmation of disability, its causes, determination the degree of occupational disability, and composition the individual rehabilitation. You have learned lecture about rehabilitation programs previous Monday. And already conclusion of our lecture today. Please, group leaders, write to the common chat the amount of people, any members of your groups, which are present here. And so early detection of disability signs or criteria in outpatient practice can contributes to the appointment of a rehabilitation program for patients, which helps to preserve their independence and quality of their life. Thank you for your attention. If you have any question, please ask me.
Thank you, sir. До свидания.
If not, next lecture, as far as I remember, it will next Monday. Same time. Thank you. Be healthy and goodbye.
Thank you, sir. До свидания.
До свидания, доктор.
Goodbye.